When people ask me how I managed to have a full-time medical career while also dealing with fibromyalgia, I tell them it's simple. Myofascial release. Hi, I'm Dr. Ginevra. I'm the author of the Fibro Manual, and I developed fibromyalgia in medical school. In this video, I'm going to share with you what myofascial release is, how it reduces fibromyalgia pain, and how you can access treatment yourself. This probably won't be news to anybody with fibromyalgia, but in this condition, our muscles and the surrounding connective tissue are tight, inflamed, and painful. This process is driven by the constant hyperactive fight or flight or stress response that we see in fibromyalgia. Essentially, it's a stress response that's gone haywire. This results in muscles that are really tight and painful. In fibromyalgia, our muscle tension levels have been measured to be 3 times the normal value. And this pathologic level of muscle tension results in the buildup of inflammatory chemicals, the buildup of metabolic waste products, and ultimately results in pain. In fibromyalgia, our fascia, the connective tissue that surrounds and permeates our muscles, is also abnormal. And what we see are excess levels of collagen and then collagen crosslinks where the collagen proteins are actually binding together. This image over here shows kind of the main cellular components that make up that connective tissue, that fascia. And these purple stripy guys here are the main component that really give fascia its strength. And part of how it does that is by both being a really strong protein, collagen is incredibly strong, but also it makes these very strong bonds between collagen molecules. And these collagen crosslinks are actually super helpful when it comes to healing a wound or a soft tissue injury like an ankle sprain, but can become harmful when they kind of go haywire like they do in fibromyalgia. And what we see in fibromyalgia is excess stickiness and excess crosslinks along with increased levels of collagen. And ultimately, that sticky fascia makes painful restrictions and adhesions. And those are really what generate pain. In part, they generate pain by kind of pressing down on the actual pain-sensing nerves that are in our fascia and muscle. And this is where myofascial release actually acts. It helps to break up those collagen crosslinks to relieve the pressure on those pain-sensing nerves, and in that way reduce pain. So what exactly is myofascial release? In its simplest definition, it's prolonged manual traction or assisted stretching. And what this does, this gentle sustained pressure helps to break up those painful collagen adhesions, lessens pressure on those pain-sensing nerves, improves the hydration and oxygenation of tissue, and ultimately reduces inflammation and pain. But to really really visualize what myofascial release is, in this image, imagine that the therapist hand here is gently pushing on the shoulder away from the therapist. And then this hand is gently pulling towards the therapist. And they do this for 3 to 5 minutes. And as this pressure is applied, you slowly feel the tissue release or the tissue stretch or melt. And as it releases and stretches and melts, you can kind of go a little bit further, a little bit further, a little bit further. And that is myofascial release. And what really makes it different than things like Swedish massage or other manual therapies is this gentle, prolonged stretching. And we're talking in the 3 to 5 minute range. With fascia, gentle pressure plus time equals tissue release. This is why the brief muscle rubbing, kneading, or stroking techniques done in typical relaxation or Swedish type massage actually have shown no benefit in reducing fibromyalgia pain. When you compare studies, this article looked at 6 different types of manual therapies for fibromyalgia, and they found Swedish massage was the least effective. In fact, 2 of the studies showed no positive effect on any fibromyalgia outcome at any time during the Swedish massage studies, compared to really significant benefits seen in the myofascial release studies. The quote here is the researcher's conclusion: myofascial release presented the best evidence of effectiveness for multiple outcomes and could be preferred over other styles. And that is a very nice, diplomatic, scientific way of saying that myofascial release totally beat all other techniques by a long mile. These are 2 other common myofascial release techniques. This one on the top here is called a cross-hand release, where the therapist's hands are kind of gently moving apart from each other and giving this nice fascial release and stretch in between their hands. And this is one of my favorite techniques. It's called an arm pull, where the therapist's hands is sort of gently providing traction, pulling on your arm this way, while at the same time stabilizing your shoulder with their hand here, and then kind of moving your arm through its entire range of motion at the same time as they're pulling with some gentle, sustained pressure. Feels amazing. One of my favorite techniques. You don't have to take my word for it. There's been some really nice studies on myofascial release for fibromyalgia pain. Most of these come out of Europe, and I think that's why the US has been somewhat slow to adopt the idea of myofascial release as a serious and legitimate treatment for fibromyalgia. In this study, which comes from Spain, they compared 20 weeks of myofascial release to a sham ultrasound. The therapy was performed by physical therapists who specialized in myofascial release, and they standardized it to 18 different stretches on specific body areas. And they really have to do this when you're studying something. You have to kind of standardize it. But when you actually are getting myofascial release as a patient, the therapist customizes it to what your body needs and where your restrictions are. The thing I want to draw your attention to here, and this is why I think myofascial release is so phenomenal, is even a month after this study ended, patients still reported significant persistent pain reduction. It's pretty impressive, and it's not common for you to see this sort of durable pain reduction. And I haven't seen these type of effects from any other treatment for fibromyalgia, whether it's a medication, a complementary therapy, a supplement. Myofascial release is unique in that it provides this sustained benefit. Another way scientists like to look at the effectiveness of various treatments for disease conditions is by lumping some of the data together to see if that gives more clarity as to the effectiveness of that treatment. And so in this systematic review, they combined the data from 6 different studies on myofascial release for fibromyalgia that got them to a total of almost 300 participants. And again, they found that same significant pain reduction. And in this, when they clumped all the data together, they actually found that not only did patients have pain reduction during the myofascial release treatments, that the pain benefit persisted even at 6 months after the last treatment. They also found that myofascial release had some benefit for sleep and quality of life. So myofascial release is the broad term for this technique of prolonged assisted stretching and manual traction of the fascia, but it does come in a few different flavors. My favorite flavor is the John Barnes myofascial release approach, because that's what has helped me personally so much. There are some other related techniques that other patients have found super helpful, and I'll go into those in a moment. John Barnes is a physical therapist who actually discovered that for his own pain that what it really took was these prolonged kind of 3 to 5 minute stretches. And he's really the one that is credited with discovering that time component. Now, MFR can be done by physical therapists. It also can be done by occupational therapists, massage therapists. At the end of the video, I will tell you how to find a John Barnes therapist near you. And also, I will go into a little bit about those other related approaches. So self-myofascial release is basically using tools and supported postures to gently stretch your own fascia rather than the therapist's hands doing it. So one of the kind of common techniques that I'll recommend, I call a T stretch. And basically you lay down on the floor with your back on this foam roller, and then you put your arms out to the side, making a T. I'm doing that right now, but you can't see it. And when you make a T with your arms here and you have kind of this melting or softening of your tissue kind of over this foam roller, what you get is this really profound, lovely stretch of your chest, your armpit, your shoulder, your neck, even your upper back. So that's a great technique. There's all sorts of different techniques you can use with each of these tools, but this is another one that I really love, the cranial cradle, which can give really nice stretch to the back of the neck there. Or you can use a 4-inch soft ball and apply it really in kind of the belly, the center of any large muscle group, like for example, your gluteus muscle. And then the tissue kind of softens and stretches around that ball. Again, the key here is time. And so when you're doing myofascial release on your own, you still want to make sure that you're holding it for at least 90 seconds, ideally up to 5 minutes. Another technique to give yourself myofascial release is called yin yoga. I love this stuff. It basically uses yoga props to do the same thing, to kind of give your kind of supports your body to be able to do those prolonged assisted stretching. And the great thing about yin yoga is they also combine it with different relaxation techniques and breathing techniques, so it can really help your nervous system relax as well. If you Google yin yoga, all sorts of free videos and books and stuff will come up. So if you're interested, I encourage you to check that out. There's also some great books about myofascial stretching and self-care. Now, I will say, though, if you've never done myofascial release with a therapist, I feel like it's super helpful to do even a few sessions with a therapist so you know what you're supposed to be feeling, so you know what that actual release feels like before you're trying to simulate it and do it on your own with various tools. So a study looking at self-myofascial release for fibromyalgia also found significant improvement in pain, reduced stiffness, and improved range of motion, less fatigue, improved quality of life. And this study, which was over 20 weeks, and it was 2 50-minute sessions per week, so twice a week for 20 weeks. And these sessions were partially customized. So some of the techniques everybody was doing, and some were specifically recommended for that person based on what the therapist thought would be helpful for them. And I think that's a really good kind of model for how myofascial release could be, kind of its benefit can be amplified if you are doing both myofascial release with a therapist and self-myofascial release. That's where I think people see the most benefit, and it's much more cost-effective as well. Myofascial release is definitely not the only manual therapy directed at the fascia that can help in fibromyalgia. Some other related techniques are Rolfing or structural integration. That is illustrated here. It tends to be a bit more of a structured approach compared to sort of the more organic approach of John Barnes. The hallmark of Rolfing is a series of 10 sessions working on the structure of the body from the bottom up. I have found it can be a bit more intense or maybe a bit more painful compared to something like the John Barnes approach, but some patients really respond to it. And I actually had one patient that found so much benefit from it that she actually went back to school and became a rolfer herself. Now, on the other side of the spectrum here is a much more gentle approach called the Bowen technique, which combines both fascial stretching with some energetic techniques. And I have found it to be a really good option for people that just can't tolerate even the more gentle pressure of something like John Barnes' myofascial release. And the final technique is osteopathic manipulative therapy, or OMT, performed by doctors of osteopathy and combines some myofascial release stretches along with other techniques like strain and counter strain. The advantage here is, since it's performed by doctors, often it might be covered by insurance in a different way. So that's something to consider and explore. And there are some small studies that have shown benefit for fibromyalgia pain with both rolfing and OMT. I absolutely admit I am totally personally biased towards John Barnes' myofascial release. I encourage you to, if you're interested, look at mfrtherapist.com, which is a directory so you can find a therapist near you. If you want to learn more about myofascial release and kind of my overall treatment for fibromyalgia, check out my book, The Fibro Manual. Until we meet again, stay fierce.